So let's just do some introductions. So, first of all, my name is Joel Thacker. I am the account executive with Humana for PEIA. And I appreciate, the opportunity and the invitation every year to come here and do a nice little brief presentation about the plan design, some programs that are available with Humana, and just remind everybody exactly how the program works and make sure that everybody understands, some of the programs that are also tied to Humana and what is available to all of our members. So, and Jill, if you want to introduce yourself too, just being part of PEIA, that'd be great. We can jump in.
Sure. So I'm Jill Beaty. I work with PEIA HR directors all over the state of West Virginia to help them to understand insurance and retirement through PEIA's eyes. And I've been with the state for about 12 years now. And so I'm happy to come and just talk to you a little bit about retirement and answer any questions you might have.
Again, my name is Joel Thacker. I'm the account executive with Humana for PEIA. I've been a part of the account management team since 2014. I've been the account executive since 2021, 2022. So, again, really appreciate the invitation and look forward to doing the presentation for you guys every year. This is kind of like a brief presentation, or brief version, or edited version, I should say, of the open enrollment presentation that I shared during open enrollment meetings in October. So we typically hold open enrollment meetings every year throughout the state. We do 13 or 14 in person all across the state of West Virginia. And then we also do 2 Zoom presentations as well. So if you're able to attend those, great, you're going to see it again. If not, that's okay too. Here it is. And I know if you have any questions, please put them in the chat. I'll be more than happy to, after the presentation, run through those, and I'll be here for as long as you need me to be to answer your questions. So with that, let's just go ahead and get started. So first off, let's do a brief review of what Medicare is. So there are different parts of Medicare. You have Medicare Part A, which covers your hospitals. Part B covers your physicians. Part D as in dog covers your prescription medications. Not everyone has heard of Medicare Part C, but Medicare Part C are Medicare Advantage plans, right? Under this plan, you are covered with both medical and pharmacy benefits. But all you need is Part B, as in boy, with Medicare, right? And continue to pay your Part B premiums every month. Right? Now, when we talk about how the Medicare Advantage plans work versus non-Medicare Advantage plans, right? There are different ways that claims are paid, especially when it comes to Medicare Advantage plans. So under a Medicare Advantage plan, especially the Humana Medicare Advantage plan, when you go to a doctor or a physician or whoever, hospital, when that claim is submitted for you, it's submitted directly to Humana, okay? Humana pays the 80% portion of Medicare, right? We also pay the other 20% all in one check, okay? And Humana reimburses your provider 100% of the Medicare allowable reimbursement rate, right? So what that means is Humana's paying your claims, Humana's reimbursing your provider, right? We are not Medicare. We're an arm of Medicare. We still have to operate under rules and regulations that Medicare set forth. So whatever Medicare covers, we have to cover. When it comes to your networks, you have what they call a preferred provider organization, PPO. This is what they call a passive PPO plan. So what a passive PPO plan means is that it does not matter whether you see a provider that's in or out of network. The benefit is exactly the same. As long as you're seeing a provider that is a Medicare provider and is willing to bill us, that's all you need. This is a nationwide plan. There are no borders with this plan. Okay? If you want to see a provider or go to a hospital that's, in Ohio, Florida, North Dakota, Arizona, Maine, you can. as long as they are a Medicare provider and willing to bill us. Okay. Now, for 2026, there were some changes that are being made by PEIA. Okay. And we'll get into the benefits because some of the benefits did change for 2026. Some of the other changes that they made, there was a 12% increase in the premium, right? And of course, your premium is based on years of service with the state. But also, we are now moved, but we were moving, now moved to what they call a decoupled plan, or what is also referred to as a NISCO plan, non-integrated sole carrier option. Basically, what this means is you still have a Medicare Advantage plan, but you also have a prescription drug plan as well, right? The benefits, the plan, how everything operates from a claims perspective is exactly the same. You're not going to see any difference whatsoever. All you have to do is make sure that you're showing your providers your new medical card. And then if you're going to the pharmacy, you're going to show them your new prescription drug card. And under this plan, you have two cards, right? Medical and pharmacy benefits. Okay? You'll see here on the screen, this is what your medical card looks like, right? And it's very specific. You have the PEI logo in the bottom left-hand corner, but you also have the co-payments that are on the bottom right-hand corner. That's office visit, specialist, hospital emergency. If you see this card, this is what that means for your medical card or medical benefits. Remember too, if you call us, we have a dedicated customer service number. It's on the back of your card. That number has not changed. If you call us, we're going to ask you for your Humana ID number. It's right below your name there on your card. Remember, this is how we identify you, right? We will never ask you for your Social Security number. We'll never ask you for your Medicare number, right? We have that in the system. We identify you by your Humana ID number, and we may ask you for your birth date to verify you are who you are, but that's it, okay? So again, kind of already went through this, but I'll go through it again. You know, starting January 1st, 2026, you're going to have two separate plans, right? You have a medical plan and a pharmacy plan. You're going to have two different cards. Should have got both of those cards in the mail. If you and your spouse are on the plan, you will have gotten two cards. They will have gotten two cards, right? Just make sure that you show your medical card to all of your providers, your doctors, and that you show your pharmacy, if you're getting any medications, show them your new pharmacy card, okay? All right, so let's go through some of the plan benefits for 2026. So again, as you see here, there are three different plans that are associated with PEIA. You have Humana Plan 1, the Benefit Assistance Plan, and Humana Plan 2, right? Most everyone is in Plan 1. If you have come over new to Humana, January 1st, 2026, you automatically have come over on Plan 1. You have to elect off of Plan 1 to either go to the Benefit Assistance Plan or Plan 2, right? Now, the Benefit Assistance Plan, there's criteria that you have to meet. That is through PEIA. Remember, PEIA handles all the eligibility, enrollment, billing, okay? Humana is hired to administer their benefits. So everything still stays with PEIA. If you have to apply for a benefit assistance plan, that still remains through PEIA. If you do, or if you feel that you would meet the criteria for the benefit assistance plan, I highly encourage everyone to fill out that application, get it sent back into them. For Humana Plan 2, as of 1/1/2026, only 79 people are on Plan 2, right? So again, most everyone's on Plan 1. If you come over new, again, to the plan, you're automatically on Plan 1. You have to elect off of Plan 1, go to the Benefit Assistance Plan or Plan 2. So just in essence of time, right? Let's just talk about Plan 1. But again, if you happen to be on the Benefit Assistance Plan or you're one of the 79 that are on Plan 2, here is a good review of your benefits, okay? So starting January 1st, you have a deductible of $300. All right. So that's the first $300 of your medical services you have to pay. You have a maximum out of pocket of $1,900. That $1,900 also includes the $300, all right, for your deductible. So that is a total out of pocket cost, including your deductible, of $1,900 in one plan year. If you meet your maximum out of pocket for your medical services, let's say in June of 2026, for the remaining 6 months of the plan year, you pay no more. Okay, that's what a max out of pocket means. Primary care physician copayment is $20. Specialist is a $40 copay. Any inpatient hospital stay is a flat $200 copayment per admission. Emergency room is a $100 copay. Any outpatient surgical procedures are a $200 copayment there. Ambulance services are covered at 100% as long as it is for an emergency use, meaning that you're not taking an ambulance from your home to a doctor's visit or from a doctor's visit to another doctor's visit, right? Has to be for an emergency use. And then skilled nursing is covered at 100%. So what has changed from 2025 to 2026? So the deductible, it increased to $300 for 2026. For 2025, it was $150. It is now $300. Max out of pocket has gone up to $1,900. Inpatient hospital stay went from $100 to $200 copay. Emergency room went from $50 to $100 for 2026. And then the outpatient surgical procedures went from $100 copay in 25 to $200 copay in 26. Okay, so those are the changes on the medical side. So again, just to reiterate, the plan still includes your prescription drug plan. All right, all you need is Part B under Medicare. Still, you don't have to pick up anything additional. Right, it's still an all-inclusive plan. You'll see all three of the plans here on the screen. Again, let's just review plan one. So starting January 1st, you have a deductible of $150. Again, first $150 of your prescription drug benefits you have to pay. You have a maximum out of pocket of $1,825. This includes your $150 deductible as well. Max out of pocket, the most that you will pay out of your own pocket for your prescription medications in one plan year. Okay. It's a 4-tier system. Tier 1 are your generics. Tier 2 preferred brands. Tier 3 non-preferred brands, and Tier 4 are your specialty medications. Right. The numbers that you see here on the screen represent a 30-day script. Right. So for Tier 1, your generics is a $10 copay for a 30-day script. Tier 2 is a $30 copay for a 30-day script. Tier 3 is a 50% coinsurance, and Tier 4 is a $100 copayment. If you take any 90-day maintenance medications, you can go to any retail pharmacy. You'll just pay 2 copayments instead of 3 for that 90-day script. Right? If you see there on Tier 3, it's a 50% of the cost or 50% coinsurance. There is a difference between a copayment and a coinsurance. Copayment is a flat dollar amount. You'll see Tier 1, $10 copay. Tier 2, $30 copay for a 30-day script. Right? Tier 3, the 50% coinsurance, what that means is you will pay 50% of the cost. So if you get a script from your doctor, you go to the pharmacy, have it filled, and for that 30-day script, if it's a Tier 3, for that 30-day script, let's say it's $300, you're going to pay $150 for that 30-day script, right? That's what 50% coinsurance means. You're paying 50% of the cost at the register, right? Now, what has changed, or what changes that were made by PEIA for 2026? The deductible, it went up to $150. It was $75. It's gone up to $150. Tier 1 went from $5 copayment to $10 copayment in 26. And then Tier 2 went from a $15 copayment in 2025 to a $30 copayment in 2026. Okay. So again, you should have both of your cards. This is a copy of your prescription drug card or PDP card. You'll see that on top it says Employer PDP, Prescription Drug Plan. Bottom left-hand corner should have the PEI seal, right? Make sure all your cards have the PEI logo, the PEI seal in the bottom left-hand corner. And then you'll see on the bottom right-hand corner, it says Medicare RX. This is your prescription drug card, right? Make sure that you're showing your prescription drug card at your pharmacy for any of your medications that you are picking up, okay? A couple other things I do want to mention as well. So there is a $35 cap, right, for any insulin products. So again, that is a CMS cap. So you'll pay no more than $35 a month for a month for any insulin products. And then now there are different vaccinations. There are Part B vaccinations and Part D as in dog vaccinations. In the next slide, we'll get into it. But for any Part D vaccinations, those are now covered at 100%, right? So a great example of Part D vaccination would be the shingle shot, right? The shingles vaccine. That used to have a cost to it. It is now $0 because it's covered at 100%. Okay, so just for educational purposes, and I think it's very important that we all know exactly how the plan works and how under Medicare how your plan is working for you. There are 3 different stages when it comes to your Part D coverage. So you have your annual deductible. You've got to pay the first $150 of your prescription drug benefits. You have to pay $150, right? After you meet that deductible, you are in the initial coverage phase, right? So that's stage 2. You are just continuing to pay your co-payments and or co-insurance in case you have a tier 3 medication. You're paying your co-payments as you go through the year, right? Until you hit your max out of pocket in stage 3. And from there, everything is covered at 100%. Does not matter what the cost of the medication is, does not matter what tier the medication is, you will pay no more, right? Trivia question. This design, this Medicare Part D coverage design changed in 2025, right? There's one thing that's missing from this design that Medicare has now made. Does anybody know what that is? I'm just going to go ahead and tell you because just to save some time.
The donut
there
hole?
is no cover. Yeah, the donut hole. Exactly. Hey, 10 points for you. You may have just gotten the number one gold medal. You are absolutely correct. There's no more coverage gap. There's no more donut hole. So when the Inflation Reduction Act was passed, one of the things that was written in the Inflation Reduction Act was this change. They have completely done away with the coverage gap and have flipped the Part D side of Medicare all on its head, right? One, you guys never had to deal with the coverage gap because you had coverage through there, right? From your benefits, you had coverage, so you didn't have to deal with that. But what also it was included in 2025 was a max out of pocket, a Medicare max out of pocket, okay? Stay with me. In 2025, there was a $2,000 max out of pocket CMS Medicare max out of pocket, okay? PEIA has their own max out of pocket, right? It is $1,825. Well, that's a lot less than the Medicare max out of pocket, right? Okay. There is a difference between how these max out of pockets are calculated. Okay? Under your plan, the PEIA Humana plan, this $1,825 includes your deductible and then any of the co-payments that you pay throughout the year. If any of all those calculate up to $18.25, you pay no more. Okay? Under the Medicare IRA max out of pocket of $2,000, the way that is calculated is what you pay for your medications and a percentage of what the plan pays for your medication. So, give you an example. If you go to, let's say if you have a, tier 4 medication. Tier 4, it's a $100 copay for a 30-day script, right? Let's say that tier 4 medication costs $8,000 for a 30-day script. There's a lot of medications that cost that much. You would pay your deductible. You would pay your $100 copay for a 30-day script. And due to the calculation of how Medicare would calculate the max out of pocket, you've now hit your IRA Medicare max out of pocket for the year. If you go and pick that up in January, for the remaining 11 months of the year, you pay nothing for any prescription that you get. Okay? I know that's a lot of information and it could be very confusing, but basically what it's stating is Medicare, because you are now a Medicare individual, Medicare has set their own max out of pocket, and it is different on how they calculate it versus how your plan through PEIA calculates it. Which means if you're going to hit a max out of pocket, you're going to hit the Medicare max out of pocket way before you ever hit the PEIA Humana max out of pocket. For 2025, we had almost 30% of all the retirees, 30% hit the Medicare max out of pocket. Okay? It's a great benefit that Medicare and CMS has provided for the retirees across the country, right? But remember, the plan's still paying for your medications, right? The plan's still paying. You're not. The plan still is. Okay? Hope I didn't confuse you on that. I did mention that there are different benefits for Part B and Part D, especially when it comes to like prescription drugs, things of that nature, right? So there are a few things that are covered under your Part B benefits that you may feel that or thought that was covered under Part D, right? So some things that you can get from the pharmacy that would be covered under your Part B or your medical benefits would be any injectable or IV medications, right? That those are typically given at a provider's office, right? Any diabetic testing supplies, insulin pumps, insulin for the insulin pumps, continuous glucose monitors, those are covered under Part B or your medical benefits, right? When it comes to vaccinations, flu, pneumonia, COVID-19, any boosters, those are covered under medical. Some of these things you can get at your pharmacy. Continuous glucose monitors are now available. If you need one, are now available at the pharmacy, right? You go to the pharmacy and, have your flu shot. You could do that. Just make sure if you're having or getting or obtaining any of those, you are also showing the pharmacy your medical card. So if you're a diabetic or if you feel that you would go to a pharmacy and get your flu shot, for instance, just go ahead and show them both of your cards, right? Just go ahead and show them both. They'll have them on file so they will bill the plan correctly. When it comes to the pharmacy benefits, right, all covered medications, all medications that Medicare covers, we have to cover, right? Diabetic medications, those will be covered under Part D. Any insulins that are administered by syringes or pens, that is covered under your pharmacy benefits. And then, of course, too, whenever it comes to vaccines, shingles, Tdap, RSV vaccines, those vaccines are actually covered under your pharmacy benefits. So you would use your prescription drug card for that. We do have our own landing page, right? So in partnership with PEIA, we have developed our own website. This website is specific to the Medicare retirees for the state of West Virginia, right? All the information about Humana is here on this website, okay? The website's there at the bottom. You can go visit the website now if you would like. The website is your.humana.com/WVPEIA. On here is all the information that pertains to the plan. It's a great review of the different plan designs. You'll have the summary of benefits, any presentation. So this presentation is loaded on there, any flyers that we send out. If you would like to know what tier that your medications are on, we have a prescription drug guide that's available there as well. Annual notice of change, evidence of coverage information, that is also loaded onto this website as well. So let's say that you go to our landing page, right, or landing site, and you're like, no, I really need to get over to PEI's site. Scroll down to the bottom, and there is a seal, and it's a direct link that you can click on that takes you directly to PEIA. Okay. So some extra benefits and services let's run through those just fairly quickly, just a reminder of what's available for you all under the Humana plan. Remember too, these extra benefits and services are covered at 100%. There's no additional cost for any of this, okay? My Humana, this is our online resource tool. You can go on to myhumana.com, register. It's a username, password, and you're good to go. We also have a mobile app. If you have a smartphone, you can download the mobile app. It's free, My Humana app. There you have access to all of this information just right there at your convenience in hand. You can check claims. You can see the status of those claims, where they're at. You can check your smart summary. We also have a digital copy of your cards as well. So let's say that maybe you lose your card or you can't find it. That's okay, right? If you have the mobile app there, you can pull it up. You can pull your copy of your card, and you can show that to your provider or the pharmacy. And then also too, if you're on the computer, you can download it, print it out, and you can utilize that. Just make sure if you do happen to lose your card, give us a call. Let us know. Go ahead and order another one. It typically takes 7 to 10 business days to get your new cards out to you. So you can utilize, this digital copy, the exact same information, right? It's just in a digital form for any of your providers or pharmacy benefits. I mentioned just briefly about continuous glucose monitors. I had this slide up in October. A lot of folks didn't realize this, but if you're insulin dependent and you want to do a continuous glucose monitor, you used to only be able to pick them up at a durable medical equipment provider, a DME provider. These are now available at pharmacies. Pharmacies have these available. Not all pharmacies do, but if they have them available, you can pick them up there as well. Again, just make sure that you're showing them your medical card versus your prescription drug card. So you won't be charged for them because it's $0 copay. I'm sure everyone is very familiar with your smart summaries. This is like your EOB, right? It's a very detailed document that shows you exactly what claims are being submitted by what provider, shows you exactly what's being paid, how it's being paid. Right. If you owe anything, it will show there on the column what you owe. Right. Of course, everybody knows you have your deductible, then you just pay your copays. So if you have anything outstanding, it should show on here as well. If you have any questions, let's say you get your smart summary in and something just doesn't look right, that's okay. Call us. We have a copy of this. We'll go through it, line by line, and make sure that it's showing correctly. If there's any questions or something that we need to do, and I'll give you a great example. We had a member call in for a couple of claims that they were showing on the smart summary. I got the call a couple weeks ago, but it was for November and December. What the claims were being submitted into us wasn't exactly what they felt that they went to the doctor and had performed, right? So we did an outreach call to the provider and made sure that they are billing correctly and exactly what the services took place. So again, make sure that you're reviewing it. You don't have to save these if you don't want to. And also too, if you don't want these to be sent in the mail, trust me, I get the comments. We're cutting down a lot of trees. You could also get these and you send them in the email, but also too, they're on the PEIA Humana site also. So you'll have copies of these anywhere that you need them, and you can always call us too. Don't forget about Go 365 and our Silver Sneakers program. So Silver Sneakers, I'm sure you all are very familiar with Silver Sneakers. This is our most utilized program. Provides you a basic gym membership to all, including participating locations, I should say. There's over 130 different locations here in the state of West Virginia. There's over 16,000 nationally. You have access to each and every one of those. Like I said, it gives you a basic gym membership, gets you in the door to that facility. Some of these facilities do have Silver Sneakers classes. These classes are more driven towards, flexibility. You're not lifting 80 pounds above your head type of scenario, right? But you don't have to do the classes. You could just get in the door. If you want to work out, walk, what have you, you have access to those. If you don't know where any of the locations are at, you can always go to silversneakers.com. In the middle of the page, there's a search tool or a bar. Put in the zip code, and it'll give you all of the locations. I think it starts at like a 30-mile radius. Or excuse me, it starts like 5 and it goes out to 30-mile radius. And this is good too, right? If you travel, if you're a snowbird, maybe take a trip across the country. You want to make sure that you have access to a couple of gyms. Sure, take a look. If you don't utilize computer a whole lot, all that tech savvy, that's okay too. Call us. Call the number on the back of the card. We'll provide you with a list of all the locations in whatever area that you're looking for. Okay. Go 365. This is our wellness and rewards program. With Go 365, as you go throughout the year, you're going to earn rewards. A lot of these rewards are based on your utilization or what you have done throughout the year. So preventive services, annual wellness exam, mammograms, colorectal screening, flu shots are now, you're getting credit for flu shots on the Go 365 program now for 2026. If you have any of those preventative services completed, there's a diabetic bundle test as well. You'll get credit on the Go 365 program. But not only, from claims or doing preventative services, but also too, if you go to Silver Sneakers locations, if you count your steps, if you do any volunteer work, if you participate, let's say in an athletic event, right? If you, play pickleball or golf or, do like a 5K walk run. Those are the things that we wouldn't have known that you did. So you have to let us know so we can give you credit. Okay. But again, as you go throughout the year, you're going to earn these rewards. By December 31st of each year, you need to make sure that you go out and redeem those rewards because it starts over every January 1st. Okay. Now, if you have rewards out there, right, you can go ahead and claim those, and they're in the form of gift cards. There's like 22, 24 different gift cards that you can choose from. I know there's, Starbucks, Walmart, Shell gas cards, Home Depot, Lowe's, TJ Maxx, Home Goods, Macy's, Darden gift cards, the restaurant cards. I think it's like Olive Garden, Red Lobster, that chain, the Darden chains, Subway, right? So again, there's a lot of different gift cards that you could choose from. I've always told folks, if you walk into the store and you see a display of gift cards, most likely those gift cards are available to you. And they're in different amounts as well, right? So you can click in there and you can say, hey, maybe I want a $10 gift card to Starbucks. Let's say you have $50 total. Maybe I want a $10 gift card for Starbucks. Maybe I want a, $25 gift card to Home Depot. You can do that. Change the amounts and just click submit. You can either get it digitally or have them sent to you directly to your home as well. The only way that you can access or redeem these rewards, you have to sign up, right? You can go to go365.com, create a username, password. You're good to go there. Again, if you don't really use the computer a whole lot, that's okay too. Call us. We'll send you a application in the mail, fill it out, send it back into us. The paper app. You can do it that way as well. Okay. Highly encourage everyone to look into it and utilize Go365. I will tell you, this is at no cost to you. You're earning these rewards. PEI elected this program for their members to utilize. Here are some examples of preventative services or preventative screenings. I always like to provide this to our members to make sure they know exactly what's available to them. Remember, these are covered at 100%. So, we've talked about vaccines, just a couple examples: flu, pneumonia vaccine, breast cancer screenings, bone density tests, prostate exams, colorectal screenings, comprehensive eye exams. That's a diabetic comprehensive eye exam, A1C test. So those are all preventative services, right, that are available. If you have any questions, go to your doctor, see your PCP, ask them, if any of these preventative services, you think that would be good for me to have, right? It's available. My plan pays for it at no cost to me, right? So you can always take a list and ask your provider, if they feel that you would benefit for some of these preventative services. We do have clinical support programs. So we do have in-home wellness exams. We partner with Signify Health to provide these to you. This is where a medical professional will come to your home and do kind of like a glorified physical exam. They'll do, heart rate, check a couple of tests. If you have any balance issues, they'll take a look at the home, make sure there's no trip hazards, area rugs, things of that nature. If you take any medications, they're going to review those medications with you, make sure that you know exactly which medications are for what. Any information that we receive out of the in-home wellness exams, we also provide back to your primary care physician as well. Okay? We do have education and resource support. We have care managers. We have senior case management nurses that, if you qualify for any of our programs, right? We have diabetic programs, diabetic education programs. We have transplant management programs as well. God forbid if you need that, we have a program. We have resources that are available for you all to utilize. And you'll have a case manager that is assigned to you, and they'll call you. Some call every week, every 2 weeks, check on you. Make sure you're doing okay. How are things? We see that you went to a doctor's visit. How did that go? Were you, did they, give you a new script, or anything has changed, health-wise? For you that we may need to be aware of, things of that nature, right? We also have post-hospitalization support. So these are post-discharge programs. First one is in-home personal home care. This is where a qualified aide will come to your home and help you with what they call activities of daily living, or ADLs. That's eating, bathing, dressing, cleaning, toileting. It's what you call custodial care, right? So remember, custodial care is not covered under Medicare, but under this program, it is available to you, right? It's up to 8 hours, so it's 2 days, 4 hours for 2 days that qualified aid will come into your home and help you. Basically, if you are discharged home from the hospital, help you kind of get back on your feet a little bit, right? There's transportation, so post-discharge transportation. This is 12 one-way trips after you are discharged home, up to 50 miles one way. So, and also too is it's either by car, van, or if necessary, wheelchair accessible vehicle as well. And it's 12 one-way trips. So let's say if you need help getting to like a follow-up appointment, right? You'll work with a care coordinator, set up the transportation, and trip 1 would be to the provider's office. Trip 2 would be home. Okay. So 12 one-way trips. And again, it's up to 50 miles one way. And then the last one is post-discharge meal plan program or meal plan. This is where we will send 2 meals a day for 14 days. So it's 28 meals directly to your doorstep. These are packed on dry ice after you are discharged home, either from the hospital or skilled nursing facility. So we understand, right? Probably the last thing that you guys are thinking about if you're discharged home from the hospital is, what's in my refrigerator that's, good, or I can cook, or maybe I don't have the ability to get out to the grocery store. It's a fantastic program that's available to you. And a lot of folks who do participate in the meal program, it comes from Mom's Meals. They say they're very good. I've never had them, but they typically say they're pretty good. And if you have any dietary restrictions or you're sent home with any dietary restrictions, let us know, right? We have diabetic health meals. We have, if you're gluten-free meals, a vegetarian, we have those meals available. We even have, if necessary, pureed meals that are also available to our members. So again, it's a great benefit. You guys, you qualify for it. If you happen to be in the hospital or skilled nursing and discharged home. So please take advantage of it. It doesn't cost you anything. I did talk just briefly about the in-home wellness exams. Again, we partner with Signify Health. They're going to outreach to you, ask you if you'd like to participate. If you do, wonderful. It helps the plan. If you do participate and do an annual wellness visit for 2026, you'll get a $25 rewards in the Go 365 program, right, that you can redeem. But if you don't want to participate, that's okay too. You can always tell them, hey, thank you, but no thank you. Please put me on the do not call list. We understand folks can either be leery of strangers coming into their home, or maybe you're comfortable with the doctors that you have and the care that you have taken place. Excellent, not a problem at all. Just thank you, but no thank you. Please put me on the do not call list. They should not call you for the remaining of that plan year. Now they'll call you the following year, right, to see if you want to participate. But again, it's not required for you to do. It's just another program that is available, to our members. Again, just a review. Here are the 2 samples of the cards. Make sure you have your medical and your pharmacy card. Know exactly where to take those. And again, if you are diabetic or if you have any vaccinations that are done at a pharmacy, just go ahead and give them both of your cards just to make sure they have both on file. Again, you'll get your evidence of coverage, annual notice of change information in the mail here soon. Those should be available. We finally got the all clear and from PEIA, so those should be coming fairly soon. And again, you'll see the number on the screen. The 800 number, that's our dedicated customer service number, right? It's a dedicated number for the PEI members. Call us. If you have any questions, you need help, call us. We're available Monday through Friday, 8 a.m. to 9 p.m. Again, my name is Joel Thacker. I'm the account executive. This is my direct contact number. I always like to try to be available to all of our members as much as I possibly can. If you have any questions, or if you get, down the line and, maybe you need some help, or maybe you don't remember exactly what we talked about or how the plan works, call me. I try to be available. If I don't answer, there's There's probably a couple reasons why I may not answer, maybe in a traveling or in a meeting. That's okay, right? I promise you I'll call you back. Please leave me a message. Please leave me a message. I promise you I'll call you back, right? I'll go ahead and leave this up here. Michelle, if that's okay, I'll leave this up here. And if there's any questions in the chat, would you like me to go ahead and take those now, or do we want to move to Jill?
Joel, you do have a few questions. I answered some as I could through through your presentation, but I figure you should go ahead and answer your questions first before I move on to mine.
Okay. Perfect. Let's go ahead and just pull those up real quick.
Would it be easier if I read them to you?
No, I got it up. I'm just going through
Okay.
them. I see where some of, yeah. Says, how does this handle more expensive medicines, such as those for osteoporosis treatment, if unable to tolerate the less expensive medications? How is it handled to get the more expensive but tolerated ones? So I think this is where this question is going, is more of if you have a name brand that was prescribed, but there is a step therapy that is attached to that medication, meaning that there may be the same medication that is available, but at a lower tier or lower cost. We would certainly want you to, try that medication, right? To see if it does work or does help. If it doesn't, excuse me, I'm sorry. If it doesn't help, or you have some adverse reaction to that medication, please have your provider write and submit in to us for that, and hopefully that will go into a review for our in our pharmacy department, and then from that review should be able to get you to the name brand drug that would work. But yes, there are some medications that do have a step therapy. There's a generic form that should do the same thing. And we would want you to try those out before any name brand drugs that might be at a higher cost. And Joe, I saw you answer this. Did an answer to this. Says, what if you have not received your prescription drug card yet? I have my number on the screen. Lee, call me. All right. You could also always call the number on the back of your card, right? The dedicated customer service number there, and ask for a prescription drug card to be ordered for you. But if you call me, I can send that over, and we'll get you a copy of your prescription drug card that you can use for the time being until your card can get in the mail. Does the Silver Sneakers program include the online program? Yes, it does, Beaty. Yes, it does. Define post-discharge. I believe you have to actually be admitted, not just overnight. That's correct. If you are admitted into the hospital or skilled nursing facility and are discharged home. So yes, you have to be admitted into the hospital or a skilled nursing facility. So admission is the key word there. Is there any kind of dental coverage, right? So routine dental benefits still go through the Mountain Air Flexible Benefits Program. Joe, I saw that you did mention that. If you look at the summary of benefits or the evidence of coverage information, you will see that they will say dental coverage, but that is any surgical procedures to like the jaw. So let's say if you have cancer, right, of the jaw or something like that, if there's a surgical procedure to remove that, that would be covered under medical. But anything routine, like routine cleaning, things of that nature, that would still reside under the dental benefits through the Mountain Air Flexible Benefits Program. Is this a follow-up to even with switching to Humana, I thought this was only when working and paying into it from your paycheck. Vicky, I'm not exactly sure what you mean. Oh, it's still an ongoing
It's the
conversation.
dental.
Sorry, let me scroll
Yeah,
down real quick. Sorry. Let me scroll down a little
it's
bit
still in
more.
the dental.
I gotcha. Gotcha. I was only seeing that one. I was like, okay, I see it's still an ongoing conversation there. Gotcha. 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 Okay. It says, is there any ramification for Go 365 rewards as far as income tax purposes? This was a problem with Go 365 program when attempted to implement with all PEI users. No, there's not. It's a completely different program when they tried to implement it through the actives. This is a Medicare program. There's no ramifications. Does Humana do away with the need for Medigap insurance? You don't. This is an all-inclusive plan. All you need is Part B of Medicare, right? Part A you're entitled to. Part B, you need to continue to pay your Part B premiums. Those go to your federal government. Thank you, federal government. And then most everyone has that coming off the top of the Social Security check. But if you decide to deny the Social Security, you have to pay that on a quarterly basis. But that's all you need. You don't need to pick up anything additional. It's an all-inclusive plan, and especially when it comes to Medicare, you cannot have two competing programs, two federally competing programs. So again, if you feel like that you want to pick up something additional, please do not. Okay, it will kick you out of this plan, lock, stock, and barrel. Right. Again, it's a fantastic. These are still fantastic programs. It's fantastic benefits that PEI are still offering to their members. I will tell you, I always like to reach out to individual sales agents, brokers, just to kind of compare what those market plans, market rates that come out every year. You know, Humana has, market plans, market rates, United, Aetna, Blue Cross. As far as I'm aware, there are variety of plans and plan differences. The biggest keys that you see is you have a passive PPO plan, right? So you can go anywhere in the country. The benefits are exactly the same, no matter if they're in or out of network. And then also to max out of pocket, there's not one plan that's on the market right now that's below a $5,000 max out of pocket for your medical services. So it's pretty good. Barbara says, verify with your provider that he or she is included in these plans. Mounted flexible benefits said my eye doctor was included when I presented my insurance card. Okay, Jill, you answered that one. Gotcha. Does my husband and I have the same plan, such as if one of us has Humana and the other goes to regular Medicare? So I can answer that very long-winded because there's different scenarios. But if you both are under the PEI plan, if you are the policyholder, he goes where you go. Okay, if you both are Medicare. Now, if you are Medicare and your partner isn't, right, then they will stay on the non-Medicare plan until they become Medicare eligible. But most of the time, PEI holds everyone in what they call the special Medicare plan. That's still through UMR. It is a Medicare plan. They hold everyone in one group, and then they bring them over one of the following plan year over to the Humana plan. There could potentially be a scenario where you are on Humana and your spouse may be on the special Medicare plan. PEI does have the ability to bring your spouse over to the Humana plan if they age in to the plan in the middle of the year. You just have to fill out a transfer form. But typically, if the spouse goes where you go. If you are, let's say, first of all, make sure that everyone's aware that Medicare is on a calendar year, so January 1st to December 31st, while the non-Medicare plans are still on a fiscal plan year. Okay, so there is a difference. And then two, because again, we do see that there are some retirees that may retire, let's say, the end of July or August. Well, they were still working. They were not on a Medicare plan yet. They retired, they're Medicare eligible. But now they have started into their new, non-Medicare plan, right? So that starts July 1st. That would be a scenario where we typically see people do a transfer form and come directly over to Humana, right? Instead of just being on the special Medicare plan, or going on to the special Medicare plan, they may do a transfer form and come over to Humana. There are different scenarios, and if you have any questions or if you're not really sure, where you're at or your spouse is at, you can always call PEIA. Remember, they handle all the eligibility, enrollment, billing, everything still stays with them. So, and again, PEIA sends us a file every week, and that file basically tells us who should be on the plan and who shouldn't, right? So they tell us who we need to make sure is on the plan and provide that information to us. So again, if you have any questions, I'll reach out to PEIA. Do catastrophic illnesses have the potential for the patient to lose Humana coverage? No.
That was a short and
For all
sweet.
my long-winded answers, that was very short. No, I was thinking about that in my head. No, it doesn't.
Sure.
Question that just now came in says, I thought I saw a statement about worldwide coverage. Was that for medical or prescription? It's for medical. And so before I get this off of the screen, let me go back to that. It's a good question. So this states it's worldwide emergency coverage. Okay. So worldwide emergency coverage, what that means is that if you are overseas in any other country, right? So Medicare is a United States program. If you're in another country, God forbid something happens, right? From an emergency standpoint, meaning you're going into the hospital, right? If you have a heart attack, stroke, break an arm, leg, wrist, something of that nature, that would be considered as an emergency, right? We would have you pay up front, pay the bill there, keep all your receipts, all the documentation. Then when you get back into the United States, you will call us. We will send you a claim form, provide all those documents and all those receipts to us, and then we'll reimburse you for those. Okay. That is for medical, not prescription, medical. But hey, if you go to Canada, some of their medications are a lot cheaper than here in the United States. All right, I'm going to stop sharing. Thank you guys for the time. I really appreciate it. Jill, I'll turn it over to you.
Thank you very much, Joel. So I'm here to talk to you about going into retirement, how to plan for that, what you'll need for PEIA purposes. I'm not sure where all of you are on the retired scenario, whether you're just thinking about it, whether you're starting to retire or you're already retired. But hopefully I will cover a little bit of whatever you need to know, and we'll take questions at the end. A big part of retirement is figuring out when you're going to retire. Most people want to retire as soon as possible, and we all look forward to that golden age. Medicare is going to make a big difference as to whether it's affordable or not. When you become Medicare eligible, then the premiums go down from the non-Medicare premiums. As a non-Medicare retiree, you can choose to stay in your PPB plans or your HMO plan. Whichever one you're already in when you retire is the one that you're going to continue once you retire. You cannot change it at the time of retirement. You can change your plan during open enrollment, which is the same open enrollment that you have now as an active employee. And then at that time, obviously, if you do it during open enrollment, then it will change on July 1st. As a non-Medicare retiree, your medical deductible for Plan A and B, which are the only two plans available, are 735 for individual and 1470 for family. Plan B is 1295 for the individual and 2590 for the family. So you can see the difference in the deductibles out of pockets is it's the same reflection as your active employee plan A and B. You pay a little bit more upfront for plan A, and you get a deeper discount on your co-insurance and deductibles and out-of-pocket maxes as a when you use it. For Plan B, you pay less each month out of your retirement check, and then you would pay a little more if and when you use it for your deductible, your out-of-pocket max, and your co-insurance. You will have the same co-pays as you do currently as an active employee. The $20 copay for your primary care visit, 40 for your specialist visit. Plan A would have that 20% co-insurance, and Plan B would have 30% co-insurance for most of their services. If you're not familiar with what the difference between a copay and a co-insurance is, Joel kind of went over it, but a copay is a flat rate that we charge for a specific service. For instance, that primary care visit of $20. Um, Co-insurance is a percentage of that amount that we allow the doctor or hospital to charge. So it is a percentage of a total amount. Your preventative services that you have now as an active employee will continue to be covered at 100% as a retiree. And so that would be your yearly annual checkup, your yearly blood work, vaccinations that Joel was discussing, colonoscopy as recommended by the CDC. Um, and you will, again, like I said, have the same open enrollment dates, that April 2nd through May 15th, as you have as an active employee to make changes to your plan. This is for non-Medicare people, that would then be effective for July 1st. You will get a notice 60 to 90 days prior to becoming Medicare eligible so that you know that you need to start preparing, go to the Social Security office, make sure that you are picking up Medicare Part A and B. So, because as a retiree, if you are Medicare eligible, PEIA does require that the members have, or members and dependents have Medicare Part A and B um, through Medicare. As a non-Medicare retiree, you will have the same network as you have currently. You would still be using UMR as your third party. So when you retire as a non-Medicare retiree, you are still going to keep that same card, medical ID card, and use that even into retirement. That one you will continue to use until one, you change your plans during open enrollment, or two, you become Medicare eligible and move to Humana. Your network, if you're not familiar currently, is called the United Healthcare Choice Network. It is all of West Virginia. It is all of the bordering counties of West Virginia. And then outside of West Virginia, it is, again, like I said, the United Healthcare Choice Network. It is one of the biggest networks in the United States. And we are in all 50 states and most of the major hospitals, except PEIA, UMR. You do want to make sure that if you move out of state, you are changing your address with PEIA. You can do that in your online portal. You can send in a change of address form from our website, which is found under our forms and downloads section. But we want to make sure that we are coordinating your care if you are living outside of the state of West Virginia, so that we know that we are going to be looking for claims that come from California or Florida or Maine, if that's where you're at. In the same token, if you are currently if have a child in college, you want to make sure you send that form in as well for them so that again, we are coordinating their care and make sure that we know that they're going to college in Massachusetts and we're going to be looking for claims in that area for that child. If you're traveling outside of the West state of West Virginia as an active employee or as a retiree, anytime it is a medical emergency, your care will be covered as if it is in network in West Virginia. So, if you just go to Cleveland Clinic, for instance, because you want to see a specialist up there, you are going to pay a higher co-insurance. If you would be in Cleveland and you break your leg and you go to Cleveland Clinic, that is an emergent situation and it would be paid at that in-state coinsurance, so the lower coinsurance, and you pay a little less. Joel touched on out of country. It would be the same for PEIA non-Medicare retirees. If you are out of the country and you're in an emergent situation and need to be seen, you would have to go and be billed and pay that bill and then bring that back to West Virginia or wherever you live in the States. And then you would submit that claim. We have a claim form on our website. Again, it is under the forms and downloads section. And then that way we could repay you what you had paid in for that claim out of the country. Your prescription drug network is the same as it is as an active employee. We still do require that 90-day supply for maintenance drugs. And that is a benefit to you because you get 3 months worth of prescriptions for the price of 2 months. You will still have some drugs that require that prior authorization, and the doctor will have to be the one that speaks to the rational drug therapy program company that we use. It is not something an individual can talk to them about. The doctor is the one that has to go through that process for you. So if you ever get caught in that, they told you that you have to call PEIA about it, and then the doctor says that you have to do this, and then the doctor is the one that has to contact the rational drug therapy to get it approved. PEIA still will have that appeal process for the non-preferred brand drugs for the cost share. You have that as an active employee, and you will have the same appeal process as a retiree if you are taking a medication in that particular, I can't remember the word, in that particular tier. Your prescription deductibles will be the same as they are now. The 150 for single and 300 for family for Plan A. And for Plan B, it's 150 for single and 300 for family. So it's the same for Plan A and B. The out-of-pockets are the same for both plans. And as you can see, the tiers, we have 4 as well. And they are the same percentage as they are as an active employee. Percentage and copay. Here is just a glance at the non-Medicare premiums. I put this on here because I do like to show that there is a difference in your years of service and your hire date, which comes into play in your premiums. So if you were hired after July 1st, 2010, that top line is going to be the one that you're going to look at for your premiums. Those are called unsubsidized premiums. It means that the legislature has ruled that the state of West Virginia is not going to put in any part or portion of the share of the insurance towards your premiums. So, for instance, if you are a non-Medicare retiree and you want to carry the Plan A, which is the one you pay the most for each month, The unsubsidized premium is $13.98, $1,398. However, if you were hired 25 years prior, so say you were hired in 2000, um, so that would put you in the subsidized premiums because it was prior to July 1st, 2010, and you have 25 years of service, you would go down to the same plan and you would be on the bottom line at $358 as your premium. So you can see that your years of service really do make a difference in how much your premium is going to be. Now, there are two ways you can use your sick leave if you fall into those dates that you're allowed to use your sick and annual. If you decide to use it to increase your years of service, that does change what tier you're going to be in. So, for instance, let's say that you are in the 15 to 19 year tier and your sick and annual days can take you into the 20 years of service. That would bring your premium from $615 a month to $461 a month for that plan A. So again, your years of service, your hire date, and your sick and annual, if you're allowed to use it, are all play a role in how much your premium is going to be monthly for PEIA purposes. So that is the Medicare or the non-Medicare side of what PEIA looks like when you retire. So let's look at once you become Medicare eligible as a PEIA retiree, you can, as Joel discussed, stay in our special Medicare plan, which means that you stay with UMR until open enrollment for Humana, which is in October, October 1st through October 31st. And then you and or your dependents, whoever's Medicare eligible, will make a choice as to which plan you want to be in, that plan 1 or plan 2. And as he said, not as many people, well, not very many people, choose plan 2 because it is comparable to plan B where you pay less each month, but you're going to pay more when you use it. You don't have as much benefit to it. The other option is when you become Medicare eligible, then you may move immediately to Humana. And the way to do that is you need to call Customer Solutions. Our number is on our website and actually at the end of this presentation. And what you'll do is you will request a Humana transfer form. They will mail it to you, and then you will mail that back with your enrollment forms. That way, we will move you directly to Humana instead of staying in that special Medicare plan. So if you are one of those lucky members who retires when they are Medicare eligible, your rates do go down. So that is a benefit to you. They go much down. In fact, we will go over that. You will pick up, again, as I said, parts A and B when you become Medicare eligible, but you will never want to pick up Part D through an outside source. PEIA is your Part D. And so if you would, and I know that especially in October during Medicare open enrollment, people are bombarded with commercials and ads and newspaper ads and calls and TV ads and sometimes they accidentally sign up for Part D through another company. When that occurs, we get notice of that, and then that automatically terminates your PEIA coverage because we are your Part D. And so, since you've picked up something else, it cancels ours. And so, you always want to make sure that you are not choosing that when you are looking at other options if you want to continue PEIA coverage. And Joel has already gone over these thoroughly, and I appreciate his presentation. I actually always learn something from him, so it's wonderful. But they do have Plan 1 and 2. Plan 1 is, as he said, the one that most people choose. And Plan 2 does not have the benefit or premium assistance, which is available to members who have a very low income in their household. Um, and we're going to go over that in a minute. But if you're 250% or more below the poverty level, we do offer assistance on premiums and on the benefit side as well, depending on, again, your hire date and how long you have had PEIA. It is also, Plan 2 is not a good choice if you're going to use your sick and annual leave to pay for your premiums, because there is no conversion amount when you're using those months credit to pay for your insurance. And so therefore you should get the better plan if you're not paying for it anyway. Your premiums will come out of your retirement check. We will automatically do that for you the first month, because sometimes it just doesn't catch up with your check. Sometimes the check doesn't come for 2 months. And so that first month, you're still going to owe for premiums. You may receive a bill for that premiums for that month in between. And so you want to make sure you are paying that. If you do not receive a bill, you can also call our customer solutions department, and they are always happy to go over how much it's going to be, how to pay it. We have several different ways. There is direct draft, there is sending in a check, there is also a link on our website where you can pay with a credit card or debit card. You will still receive the tobacco discount if you are tobacco free as a retiree. 25 for single policy and 50 for multiple member policy. Um, if your retirement or your retirement amount does not cover your premium amount, so for instance, if you are in that unsubsidized premium amount and you pay $13.98 per month for your insurance, but your retirement check is only at $1,200, we would automatically direct bill you for the full amount. We would not take a portion out of your retirement and then bill you for the rest. It would be totally direct bill to you. So, if you are allowed to use your accrued leave for premiums, that means that you were hired prior to July 1st, 2001. All right. If you are hired prior to July 1st, 2015, then you are eligible to use your accrued leave to extend your years of service. You have to choose one or the other. You cannot split them between both. And that is on the retirement forms for you to choose which way you want to do it. You also have CPRB forms that you would fill out. And if you choose something differently on the CPRB form than you do on our form, their form will prevail. They will do it that way. It doesn't matter what you marked on ours. So make sure you're choosing the same thing on both of the forms when you fill them out. Accrued leave pays for any of our plans. So it can pay for our plans A, B, it can pay for our HMOs, and it can pay for your Humana, Medicare. To be able to use your accrued leave, you must go immediately from retirement or from active employment into retirement. PEIA cannot accept frozen accrued leave to pay for premiums or to extend years of service. It is not available for anybody who is hired after July 1st, 2001, or if you had a lapse in coverage after July 1st, 2001. So, for instance, if you were hired back in 1999 And then you left and went to the private sector in 2015 and then came back to WVU in 2020, you would not be eligible to use this benefit because you had a lapse in coverage that you were in the private sector. If and when premiums increase and you are using your accrued leave, it will not affect the balance of how much leave you still get because it's not the price of the premium that you are being valued for your sick and annual leave. It is the months of credit that you get for it. So for those who are eligible, if you were hired prior to July 1st, 1998, you are allowed to use 2 days of your leave to convert for 100% of a single plan. If you want to have a family plan, it is 3 days for 100% of your premiums. If you are hired after July 1st, 1998 or 1988, but prior to July 1st, 2001, the legislature changed the rule to 50% of the premium would be paid. So it's the same translation. It's still 2 days for 1 month single and 3 days for 1 month family, but you would be billed for half of the premium through your retirement check, and your agency would be billed for the other half of the premium. Those lucky people who have that benefit. All right, so this is just a chart that's out of our Medicare rate chart. It is another, just to give you an example of the difference in price. So if you remember on the non-Medicare chart, you're a non-Medicare retiree, you have the unsubsidized premium, which is that top line. It was $13.98 was the price for Plan A. So if you are a Medicare retiree for the comparable Plan 1, even though you are unsubsidized, it's only $309, which is very, very close to what the rate was for a non-Medicare with 25 years of service. Um, then we go down to those who were hired prior to July 1st, 2010, and they have 25 years or more of service. So those say they were hired in 1999. They want to choose the best plan, Plan 1. They're only going to pay $91 a month for a single plan. Now, if you scoot on across the chart, you're going to see that the prices increase if the member has a non-Medicare dependent. So it goes on the top row from 309 for single to 1529 for a member with a non-Medicare dependent. And then we go one more, and you're still going to have that same Plan 1, but they have a Medicare dependent, and it goes down $900. So this is why I say that having Medicare is a key to retirement. It's really important that we have that Medicare card, that you're set up with Medicare so that you can get the lower premiums for your retiree rates. This is just a list of the plan's cost sharing, which actually Joel went over, and I appreciate that. Medical deductible for Plan 1 is $300, where for Plan 2 it is $525. So you can kind of see as you go down the rate chart where you're going to see it's less expensive when you use Plan 1 than it is when you use Plan 2. The out-of-pocket max 1900 versus 2650. And then in the middle column, you're going to see where the benefit assistance comes into play. As I said, benefit assistance is available to members who were hired prior to 2010, July 1st, and they have 15 years or more of service. and they meet the 250% or more lower than the federal poverty level. That poverty level changes each year. And PEIA, what we do is to all of our retirees, we send out a benefit assistance letter, and members can send in proof of their income. And then we can assess whether we are able to give them one, premium assistance to lower their premiums, or two, both of them, to give them benefit assistance. So the middle column, instead of 300 for plan one, that person is only paying $50 for their deductible. Instead of their medical out of pocket for 1900, they only have to pay 650 to meet that out of pocket max, and then the plan pays 100%. Their primary copay is only $2 as opposed to 20. So again, this is a value to our members that you want to make sure that you're filling out that form once you retire and to see if you're eligible so that we can give you that benefit. Surviving dependents, if you would pass as an active employee or a retiree, PEIA, once we know of the passing, will send out a surviving dependent packet to each member who is covered at the time that you pass. Once they sign up, we will cover them back to the time that you pass, so there is no lapse in coverage. Children will still continue to fall off at the time that at the end of the month in which they turn 26. Spouses must cancel their insurance if they remarry, because in that instance, they are no longer your dependent, but they are the dependent of the new spouse. And it is insurance fraud if they would continue to keep PEIA in your policy name. You do also want to make sure that you understand if you are using your month's credit to pay for your insurance premiums and you would pass, then that benefit disappears. Your survivor signs up for their own plan and is no longer eligible for that benefit of your month's credit that you used your accrued leave for. And that's what I just said. And then this last screen is, as I said, how to get in touch with our customer solutions department. They do make appointments. If you're thinking about retiring, please email them or call and set up an appointment. They will take up to 45 minutes with you, going over the forms, going over information step by step, what to expect, who to contact. They will help you with figuring out what your premiums may be. They cannot give you an actual quote on your premiums because they do not have all the information. That only comes once we've processed it through the retirement board. But they can give you a good estimate based on what you're telling them, how many years you've been, when you were hired, that kind of thing. With that, I am going to jump on the chat and see if there is any questions. Okay. Barb asked, when were we officially notified of the increases we saw this month? All right, so those increases were in your book that you would have received in October. They would have been in the front part, which it would say something like new, coming, make sure you know about, notes to know. It's almost always in the first part of our shopper's guide when we send it out. My monthly amount for 25 years of service with tobacco-free discount is more than I expect. Is there a tax? PEIA does not charge taxes on your insurance. So if you're unsure of what your amount should be or why you think it's too much, please contact that customer solutions department. The insurance or the information should still be on my screen to ask them. They will be able to verify what your amount should be. Any other questions for me? Joel, I think you must have covered everything, so they don't have any questions for me.
Joel had to run away.
Ah,
So, if
okay.
anybody did have any other questions, you can email them to him.
All right. Well, if there's no other questions, I really appreciate your time and attention. I will make this presentation available to you, Michelle, so that if you need to send it out to your members, you can do that. Thank you for having us.